TV personality Dr. Drew Pinsky says he's concerned about Hillary Clinton's health and her health care. In February, there were photographs that surfaced of Hillary Clinton being assisted going upstairs at a campaign stop. Dr. Drew also referred to Clinton's fainting and falling in late 2012 and referred to the type of enhanced eyeglasses that she was wearing in other photos. The chairman of medicine, vice president of Newark Beth Israel Medical Center is with me now, Dr. Lahita. Dr. Lahita, welcome back. Great to see you.
Hey, Deirdre, good to see you.
Do you agree with Dr. Drew on all of those points?
Not on all of those points, but I do agree with Dr. Drew that this is a very unusual story with Hillary. 2 blood clots. She's had this stroke, which is in 2012, where she has a transverse sinus. Very, very rare condition. She hit her head, and they're attributing it to the fact that she hit her head. Then she had a post-concussive syndrome, and if you remember, she was wearing a sunglass at one of the conferences before the Senate, where she had double vision and couldn't see properly. The very fact that she's having these clots and she's had 2 bouts of thrombosis is disconcerting, to say the least.
So you do think then that the concerns objectively, no matter where your politics are, the concerns about her stamina and her health are justified because you have a lot in the liberal media saying this is a conspiracy to disqualify her somehow?
I don't think it's a conspiracy. And, you know, you go back to the history of our presidents, and we've had many presidents up until Lyndon Johnson who concealed their health during their campaigns. And it had dire effects for our country, going from Kennedy to Roosevelt to Woodrow Wilson, whose wife ran the White House for some time. So we have issues here, and I think both candidates should be very forthcoming and have perhaps an impartial panel of physicians review the data and make that kind of a decision before the Americans go to the polls.
So Donald Trump, we know, did release a letter from his personal physician, and then Hillary Clinton did do the same recently, but it was from 2015. And Dr. Ben Carson was on my show about a week and a half ago, and he said we should have a more current letter.
We should, and we should be able to see the laboratory results ourselves. The letter is kind of a summary, doesn't go into much detail. She's also hypothyroid, and there are conditions where blood clotting and hypothyroidism go together, and that would be quite interesting.
So, baseline, what is, let's say, acceptable because of privacy laws for both candidates? If you were to have this independent panel of physicians, what would ethicists say on either account?
Well, the ethics of this is pretty clear. We cannot, or the doctor cannot divulge her results without her permission. The same thing is with Donald Trump. Nobody can divulge his medical history without the patient's permission. However, we owe it to the country, we owe it to the voters, not only for the presidential candidates, but also for the vice presidential candidates, particularly in this election.
Indeed. Dr. Lahita, great to see you. Thank you for lending us your expertise. Dr. Lahita.